Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help guide you through the Thomas assessment or test. So what is a Thomas test? The Thomas test is performed to determine whether hip flexor muscle tightness and the existence of a hip flexion contracture are present. The patient rests flat on their back, their knees bent and their feet flat on the exam table while undergoing the Thomas test. The patient's leg is then passively flexed towards the examiner's chest while the other leg is relaxed. The examiner will observe how the patient stands on their other leg to see any tightness or contracture in the hip flexor muscles. A tight hip flexor muscle can be a result from numerous issues including lower back discomfort, hip pain, or difficulty walking. Medical professionals and physical therapists can assess whether stretching or strengthening activities are required and whether more medical treatment is needed. There are a variety of healthcare professionals who can use the test, however, it is commonly used by physical therapists. Here's how to use a Thomas test effectively. The first step is to fill in all the client information. You'll then need to conduct the assessment. The final step is to make the necessary recommendations and notes. To view a sample assessment of the Thomas test, feel free to visit carepatron.com where you can download and access it for free. You can also access the test via our platform, filter by community and assessment, or type in the keywords to find the note. Thanks for watching, and remember to subscribe to Carepatron to view more healthcare videos.